so that we find a new way to make connections while they're learning. And the earlier we begin to work with survivors, and I don't mean we like personally, but the earlier that they get cognitive training and they get somebody to work with them and they get a good IEP and they have special help, the better they do in the long run. We maximize the potential. Can we change the fact that we deliver radiation to a growing brain? No. But what we can do is maximize the individual's learning potential and decrease frustration, because the worst thing is to have a young, beautiful child who wants to learn but doesn't have the resources to figure out how they now need to learn things. So that's very important. Again, we've really begun.
Could you go back? What is
leukoencephalopathy? That's something that we only see, we used to see much more in the old days when we used a combination of chemotherapy and radiation at the same time. So for those of you who have children who got this drug, you'll know what I'm talking about when I say it, methotrexate. So in the old days, we gave methotrexate and radiation at the same time.
That's not too old days. I mean, come on, some of us had treatment recently, we were doing stuff like that.
Well, again, I'm talking about at the exact same time. Intrathecal methotrexate and radiation at the exact same time is generally not given anymore. I'm not saying that you don't get methotrexate and radiation, but what they learned is not to give them concomitantly. So in the 70s, we literally, at the time the child was getting cranial radiation, we were doing spinal taps and giving methotrexate. And what we learned from Dr. Archie Blyer 30 years ago is that what happens is the radiation lowers the blood-brain barrier. And then we were giving methotrexate, and it allowed a higher saturation of methotrexate. So we don't do that any longer. We give radiation, we give methotrexate, we don't give them together. So in the children who got it together, we saw more leukoencephalopathy. What that is that years later when we scanned brains in children who were having significant issues, we would see white areas in the brain, and that was called leukoencephalopathy. Again, we try to eliminate or reduce the dose of radiation. So where in cases with children who had brain tumors, such as medulloblastoma, we started out where we gave 3,600 centigrade to the whole brain and the spine, and have moved to 2,400 to the whole brain. And now we're going to have proton therapy that can be very, very specifically beamed, but we don't know what the outcome of that will be. We believe we will spare more healthy tissue, and then the child will have less effects of therapy. But again, it's going to be very important. You know, brain tumors are very similar to real estate. It's about location, location, location.
My daughter had full brain small radiation from glioblastoma, but she had proton radiation.
Right.
We were told because you're still radiating the entire brain that cognitively the late effects would be the same. It's just you're sparing the cochlea and so they
well, I just don't think we know enough yet. I think that intuitively we would think it would be better.
Well,
because certainly if you can spare the cochlea, and your daughter won't lose hearing over the rest of her life, she will have one less barrier to overcome. Because children who have impaired hearing then have another barrier to overcome. So just in doing that one thing, even if we don't spare any more tissue other than our cochlea, we've done something good. But again, I think that we don't know yet. And I believe, I know at CHOP, we have 2 studies already established where we're going to follow these children so that we will be able to very quickly come back and make adjustments if we have to. And really, survivors, all of your children, are the pioneers. Every day they live, they are the pioneers showing us, healthcare providers, what it means to be a survivor, and gives us invaluable information. Because everything we've changed in therapy has happened from following survivors. Because we see an effect and then we can go back and alter therapy.
You don't have to explain this, I just want a yes or no. Is every brain tumor available for proton therapy? Like
No.
No. Okay.
No.
Thanks.
No. And proton therapy has not been widely used until the past couple of
we
years.
were turned down. Boston wouldn't take us because she was relapsed, so they turned us down. So we had to find a center who would agree to treat
There are
her.
5 in the United States.
Right. And it does depend. It's a lot like, I think with proton therapy, we're almost in the same place we were 20 years ago with bone marrow transplant. You had some centers that were willing to go gung-ho, and even if every other center turned you down, they would try it. So I think that, you know, it's a growing science right now, and no, every child is not going to be eligible for proton therapy. And again, you see this one right here is that we really avoid methotrexate right while they're getting the radiation. Certainly monitoring educational performance, again, where I talked a little bit about, the earlier we intervene, the better effects we see. Okay, so that's a very big one. Cardiac is another very big area that families have concern about. And the kinds of treatments that we generally are concerned about heart function are anthracyclines. And again, I'm going to say a couple of the names, and your child either got them or didn't get them, and if you don't recognize the name, you're probably your child didn't get them. Doxorubicin, adriamycin, idarubicin, epirubicin, those are the rubicin family. And they can cause cardiac effects, and certainly direct radiation to the heart can certainly affect the heart. Very different ways in which they cause it. And what I can tell you is the majority of children do not have cardiac effects. We monitor them very closely, and you might say, okay, Wendy, so then why are you doing EKG and echocardiogram every 2 years if you're not worried? Because we'd rather be safe than sorry. Because what happened in the early 60s is we began to cure children we treated with very high dose anthracycline, and we thought healthy heart at the end of therapy, healthy heart forever. Well, we learned that's not the case. And so what we do is we watch, and if we see an incremental change, we do something before it becomes a big problem. And again, what we try to do is in survivorship, we no longer focus on the primary disease. Survivorship, we focus on health maintenance and health promotion within your child's story. And so in the sense of looking at cardiac risk, we realize that there's some things we can't change. We can't change if the child received radiation, and we can't change anthracycline. But there are things that are in our control to reduce cardiac effects. So hyperlipidemia, we keep an eye on lipids, cholesterol, high-density lipoproteins, low-density lipoproteins, and triglycerides. Hypertension, type 2 diabetes is huge on the rise. So we really talk about maintaining ideal body weight and doing aerobic exercise, not smoking, limiting alcohol, and doing aerobic exercise versus isometric exercise. In some ways, I don't even feel like exercise should be put next to isometric. I know that that's probably heresy saying that, but it's not cardiovascular exercise. And that's what we're all about, is we want to promote cardiovascular exercise. So I'm going to leave the physical realm and go a little bit more into the psychosocial effects. Again, by no means did I cover everything, but usually for most families, those are the biggest topics. So again, Kuchar and O'Malley were the folks who started doing research early in the 80s, and basically there was a picture of overall health, mental health adjustment. And there was evidence that yes, that there was some anxiety and some depression, and that there was a subset of survivors with significant problems, but not out of percentage that we would see in the general population. And certainly when we think about some of the stressors of having a child survive cancer, you know, I think that most families fear recurrence. I certainly believe that that is something that most are very fearful of. You know, concern over what the physical outcome is going to be of the therapy that your child receives, anxiety and post-traumatic stress. I know you've heard about that this morning from Dr. Alderfer. Certainly some of the financial, employment issues and school-related issues for your family and your child. This took a hit on everyone. This wasn't just one person who had cancer. And certainly the interpersonal issues for the child, and again, the family as well. Kind of social well-being and re-entry into whether it's back into school or back into college or back into a friend setting, intimacy issues and sexual functioning, when a survivor chooses to share with somebody that they're going to have a relationship with, that they are a cancer survivor and there might be issues. Those are all things that certainly are very heavy issues to deal with. Conversely, many families will speak to some of the positive outcomes. Not that you would have chosen to have gone through this, certainly not, but that there is a greater appreciation for life, a renewed spirituality, improved self-acceptance and self-awareness. I mean, I'm sure you all have friends who are whining to you about stupid things that their kids are doing, and you want to look at them and smack them in the head, and go, you don't even know what real problems are. A strength with relationships, with significant others, increased ability to cope with adversity. I mean, think about what you all have done. Think about what you all have done. And you probably, if someone asked you 2 years prior to your child having this disease that you were going to have to do this, you would have probably asked yourself, I'm not sure I can do this. And you've all done it. And so that really is amazing. And being a bit more present-centered, like we're here today, things are good now, can't think too far into what tomorrow's going to bring we have today. And I don't mean to say any of this in a glib way. I don't mean to misrepresent any of you. This is just some things that we have learned from families. It's not that there's a one fits all for any one family. And again, you heard about this morning about post-traumatic stress disorder. And I think that people really do get the idea of why cancer is traumatic. I mean, I think that you heard about this morning. Some people say, well, then why would survivorship be traumatic? And what we find is that, when you have to continue to be vigilant, when you have to continue that worry, is my child going to be okay? Now the disease is gone, and now I need to deal with these things. And understanding that, there might be medical vulnerabilities, and then also the treatment-related losses, whether it be fertility, cognitive functioning, or just, this is how my child was before, and that isn't, and I'm not saying again that changes for everyone, but in some cases it does. And so survivorship can be traumatic, and it's very important to us in survivorship that when we work with a family and a child, it's not just about one person or one piece, it's about the whole family, and it's both about the physical and the emotional. You heard about that. So successful survivorship, how is it that we deal with all that we have to deal with and move on? And certainly integrating the cancer event. What the heck does that mean? Well, it sounds good on a slide, but what does that really mean? And I think that it's going to vary for every family, how they're going to be able to kind of find a place for cancer so that every minute of every day isn't about cancer. Because the totality of all of you isn't just about cancer. And I've had many survivors not even want to talk about cancer anymore because they say to me, that was my past, this is my future. And so kind of helping your child and family say, okay, we can't deny that this changed us forever, but we don't want it to become, define you. Exactly. We don't want it to define us. Finding meaning, and again, finding a personal story. Many survivors and families don't have a lot of places where they can talk about what they've been through. Families, you can tell families, they'll listen for so much, your family. Friends, you can tell them a little bit, but at some point they get that blurry-eyed look like, oh my God, what am I supposed to say now? And sometimes they don't know what to say, or sometimes they're silent, and then you stop talking. And then you feel like you have everything bottled up inside. For really finding a forum where you can really talk, you have your personal story, and you have your journey to talk about. And hopefully in survivorship we can allow for a little bit of that too, because we need to pay homage to where you've been before we can plan the journey that we're going to go to together in the future. We talked about some of these kinds of things already. So kind of, and again, I apologize because I've kind of had to take you on a journey like warp speed. But this kind of takes us to why we believe so strongly at CHOP and many other centers about the importance of comprehensive care. Wendy Hobbie is actually a very well-known author who is an oncologist and also a lymphoma survivor of multiple relapses. And she has written many, many books, and one of my favorite quotes that she put in is that comprehensive care of the individual with cancer demands the same expertise, energy, empathy, and support that were provided during the crisis of diagnosis and treatment be provided throughout survivorship. I mean, I'm amazed. You walk into oncology and you get a book, and the book, you open it up, and the book says, okay, if the fever goes this, you do that, and then therapy ends. Bye, see you in a month. See you in a month? What do you mean see you in a month? What's going to happen if the fever comes up? What happens if this happens and that happens? And so when we go back to that slide, I'm not going to bore you and go all the way back where I said 3 years is spent in treatment and all the rest of the years are spent in survivorship. That's why it's so important that we really do emphasizing the importance of comprehensive care and taking care of the family.